Understanding pelvic floor. Prolapse. When things shift out of place as we age. Our bodies are complex and amazing structures. They are also delicate in some ways and take maintenance as we age. The pelvic floor is one area that can weaken over time in both men and women. This can lead to a condition called pelvic floor prolapse. Prolapse happens when the muscles and tissues supporting the pelvic organs weaken. These organs include the uterus, bladder, urethra, prostate, seminal vesicles, and the rectum. When these muscles weaken, the organs can start to drop. This can cause a feeling of pressure or fullness. Pelvic floor prolapse is significantly more common in women than in men. This difference is primarily due to the anatomical and physiological differences between the sexes. Imagine the pelvic floor like a hammock. This hammock holds your pelvic organs in place. If the hammock weakens, it can sag. This allows the organs to shift out of their normal position. Vaginal prolapse in women is quite common as we age. Studies suggest that nearly 50% of women who have given birth will experience some form of pelvic organ prolapse in their lifetime. Approximately 10 to 20% of women may require surgery for pelvic floor prolapse. For men, pelvic floor prolapse is rare, and specific prevalence rates are not well documented. Most pelvic floor disorders in men are related to urinary incontinence and are often associated with prostate issues rather than prolapse itself. Common culprits. What puts you at risk? Several factors can increase a woman's risk of developing vaginal prolapse. Childbirth is one of the most common. During delivery, the muscles and tissues of the pelvic floor are stretched and strained. This can weaken them over time. Age is another factor. I remember in college how I learned about the elasticity of the rectum waning as we age, causing incontinence. While the vaginal pelvic muscles also naturally lose some of their strength and elasticity. I nursed a loved one with prolapse, and out of all her conditions, this one was the most difficult to repair once it happens, so prevention is truly the answer on this terrible consequence of aging. People rarely think of this normal part of aging, but various measures can be taken to minimize the impact. Hormonal changes during menopause, particularly the reduction in estrogen levels, can lead to a weakening of the pelvic floor muscles and connective tissues. Obesity also plays a role. Carrying extra weight puts added pressure on the pelvic floor muscles. Over time, this can lead to weakening and prolapse. Other factors that can contribute to prolapse include chronic coughing, constipation, and heavy lifting. These activities all put stress on the pelvic floor. Men have a few other factors that may increase their chances of developing pelvic floor prolapse, but it is much more common in women. Surgical procedures like prostatectomy can weaken the pelvic floor muscles and connective tissues, potentially leading to prolapse. Like women, activities that involve heavy lifting or chronic constipation can strain the pelvic floor. Muscle tone and strength, including those of the pelvic floor, can decrease with age, and obesity can cause added pressure on the organs. Recognizing the signs. Symptoms of vaginal prolapse. Vaginal prolapse can cause a range of symptoms, from mild to severe. Some women experience a feeling of pressure or fullness in the vagina. This may feel like something is falling out. I have made a choice to limit the photographs of prolapse because it can actually wear quite bad where the organ and rectum are protruding outside the body. So you will have to imagine. Other symptoms include a bulge or tissue protruding from the vagina, difficulty with urination or bowel movements, pain during intercourse, and lower back pain. It's important to note that not all women with prolapse experience symptoms. Some women may have mild prolapse without realizing it. Men may experience a feeling of heaviness, pressure, or fullness in the pelvic area, which can progress to pain or discomfort that may worsen after standing for long periods or lifting heavy objects. Another symptom of prolapse in men is difficulty starting or maintaining a urine stream. Frequent urination, including nocturia or nighttime frequency, urinary incontinence, including stress incontinence or leakage during activities that increase abdominal pressure, can also occur along with a sensation of incomplete bladder emptying. Bowel symptoms include constipation or straining during bowel movements. Men and women can also feel a sensation of incomplete evacuation after a bowel movement. Similarly, rectal pain or discomfort and fecal incontinence is possible in severe cases. Erectile dysfunction or difficulty maintaining an erection is a symptom in men along with pain during sexual intercourse and decreased sexual satisfaction. In severe cases, a bulge or lump may be visible in the perineal area between the scrotum and anus, indicating a significant prolapse. Lastly, some men may experience lower back pain related to the strain on the pelvic floor muscles. Beyond discomfort, complications, and related issues. If left untreated, prolapse can lead to additional complications. One common issue is hemorrhoids. The pressure from prolapse can strain the veins in the rectum, causing them to swell. This can lead to severe pain, itching, and bleeding. Frequent vaginal infections in women and increased urinary tract infections can occur in both men and women. When the bladder or rectum presses on the pelvic floor, it can make it difficult for urine and feces to empty completely. This can create a breeding ground for bacteria, increasing the risk of infection. Incontinence, or the involuntary leakage of urine, is another potential complication. Prolapse can weaken the muscles that control urination, making it difficult to hold in urine. This can be an embarrassing and isolating symptom. Section 5. The power of intimacy. Health benefits of sex for all. Sexual activity offers a surprising array of health benefits for both men and women. These go far beyond pleasure and emotional connection. Regular sex can boost the immune system, improve cardiovascular health, and even relieve pain. For women, sex helps maintain the health of the vaginal tissues. Intercourse increases blood flow to the vagina, which helps keep the tissues elastic and healthy. It also stimulates the production of natural lubrication, which can become an issue as women age. Men also benefit from the physical activity of sex. It can lower blood pressure and reduce the risk of heart disease. Additionally, regular ejaculation has been linked to a decreased risk of prostate cancer. Section 6. The chemistry of connection, hormones, and well-being. Sex is a powerful trigger for hormone release in both men and women. These hormones play a crucial role in our overall health and well-being. During sex, our bodies release endorphins, which have mood-boosting and pain-relieving effects. The hormone oxytocin, often referred to as the cuddle hormone, is also released during sexual activity. Oxytocin promotes feelings of bonding, trust, and intimacy. It also plays a role in reducing stress and anxiety. For men, testosterone plays a key role in sexual function and desire. Regular sexual activity can help maintain healthy testosterone levels. Section 7. The price of inactivity. When desire dims, health can too. While many factors can influence libido, prolonged periods of sexual inactivity can have consequences for both physical and emotional health. For women, a lack of regular sexual activity can lead to vaginal dryness and thinning of the vaginal walls. This can make intercourse painful and increase the risk of vaginal infections. Additionally, a lack of sexual stimulation can weaken the pelvic floor muscles over time. This is because the pelvic floor muscles are engaged during sexual activity. Without regular use, these muscles can become weak and less supportive. The emotional and psychological effects of sexual inactivity should not be overlooked. A lack of intimacy can lead to feelings of isolation, loneliness, and low self-esteem. Section 8. Reclaiming strength exercises for pelvic floor health. The good news is that there are things both men and women can do to strengthen their pelvic floor muscles and improve or prevent prolapse. Pelvic floor exercises, also known as Kegel exercises, are a simple and effective way to target these muscles. To perform Kegel exercises, first identify the right muscles by trying to stop the flow of urine midstream. Once you have identified the muscles, contract them for a count of 3 to 5 seconds, then release. Repeat this exercise 10 to 15 times, 3 times a day. Other activities that can strengthen the pelvic floor include yoga, Pilates, and swimming. Strengthening the pelvic floor muscles can lead to improved bladder and bowel control, enhanced sexual health, and overall well-being for both men and women. Regular practice of Kegel exercises can help prevent issues like incontinence and prolapse and contribute to a more active and confident lifestyle. Section 9. Solo support. Can masturbation help? Masturbation can be a healthy and normal part of sexual expression. While it cannot replace the full range of benefits associated with partnered sex, it can offer some benefits for pelvic floor health. During masturbation, the pelvic floor muscles are engaged, although perhaps not as intensely as during intercourse. Regular masturbation may help maintain some muscle tone and blood flow to the area. However, it's important to note that masturbation alone is unlikely to prevent or reverse prolapse. Pelvic floor exercises and other lifestyle modifications are crucial for addressing this condition. Section 10. Seeking help and finding hope. You are not alone. If you are experiencing symptoms of vaginal prolapse, it's essential to seek medical advice. A healthcare provider can assess the severity of your prolapse and recommend appropriate treatment options. Treatment for prolapse varies depending on the severity of the condition. In mild cases, lifestyle modifications and pelvic floor exercises may be sufficient. For more severe cases, a pessary, a removable device inserted into the vagina to support the pelvic organs, may be recommended. In some cases, surgery may be necessary to repair the prolapse and provide long-term relief. It's important to discuss all treatment options with your doctor to determine the best course of action for your individual situation. In conclusion, it's your body, your health, your choices. Vaginal prolapse is a common condition that can significantly impact a woman's quality of life, and while less common, pelvic prolapse in men can also be quite debilitating. Understanding the causes, symptoms, and treatment options is crucial for taking control of your pelvic health. With the right care and support, you can manage your symptoms, improve your quality of life, and embrace a future filled with confidence and well-being. So until next time, laugh, love, and be healthy.